Okay, this video is part 9 of Prevent and Reverse Obesity by me, Pete Rogers. If you're following along with the book, we're on page 60. And we just were talking about insulin resistance. And the most important thing to know about insulin resistance is that the main cause is fat leading to overnutrition within the mitochondria and inhibition of intermitochondrial membrane electron transport. The mitochondrial membrane gradient goes too high and they no longer can pump the complexes, like complexes 1, 3, and 4 are no longer able to pump protons against an excessively high gradient, and it starts going in reverse and you start dropping electrons down into the mitochondrial matrix producing free radicals, superoxides. Okay, so anyways, that's called overnutrition. All right, and then once that happens, the mitochondrial senses what is called overnutrition, sends a message to the cytoplasm. Don't let the glucose transporters, glucose type 4 transporters, go to the plasma membrane. And because these transporters do not merge with the plasma membrane, the glucose can't get into the cell, so blood glucose remains persistently high after eating. So eating is called prandial. This is postprandial hyperglycemia. This is the most important thing you can know about diabetes. Fat is absorbed more rapidly, gets into the skeletal muscle more rapidly than does the glucose, and it overwhelms the mitochondria, causing insulin resistance. That's the most important thing you can know about all of diabetes. And so you want to avoid that. And that's why people with diabetes should eat low-fat diets. And as Dr. McDougall said, they should be counting fat, not counting carbohydrates, because the fat makes you insulin resistant, and it lowers your carbohydrate tolerance. Okay, now here's a diagram showing that what we're talking about, carbohydrate tolerance. So if you just eat the starch alone, your glucose only spikes a little bit and maintains relatively good a prolonged amount of time. If you eat the fat first, the fat causes insulin resistance, so that when you chase it with the carbohydrates, you follow it with the carbohydrates, your blood glucose spikes significantly higher and stays elevated a prolonged amount of time. So you'll have prolonged postprandial high blood glucose, hyperglycemia. You don't want that. Insulin resistance is associated with causing a whole bunch of other diseases. And here's another big slide. You want to see this, okay? This is how does fat get into the skeletal muscle cells? Well, what happens is the fat gets absorbed into the blood more rapidly, and then it can get across the skeletal muscle plasma membrane more rapidly. It'll do something called the flip-flop maneuver. It can become protonated, a fatty acid, and intercalate itself into the outer leaflet of the plasma membrane. Then it can flip into the inner leaflet of the plasma membrane, and from there go into the skeletal muscle cytoplasm. So it gets into the skeletal muscle faster than the glucose does. Then it gets into the mitochondria, and it causes insulin resistance. Okay. All right, let's see here. I'm just sort of showing you the pictures, talking about the pictures. I've got the reference to these in other lectures. If you want to look up the papers and stuff, I got references for all this stuff. Okay, a little bit about what the different types of fats are. Fat with no double bonds is called saturated fat, because all the carbons are saturated with hydrogen. If you have one fat that's a monounsaturated, unsaturated means to have a double bond. So monounsaturated, the characteristic thing is like oleic acid and olive oil. Okay, and here's a PUFA, polyunsaturated fatty acid. That means there's more than one, at least 2 double bonds. So here's the first one, here's the second one. You count them from this is the carboxylic acid right here, the carboxyl end of a fatty acid. This is the methyl group at the end, CH3 group at the end. So this is a methyl end of the carboxylic acid. A fatty acid is a carboxylic acid, okay? It's also called the omega end, all right, or the W end. And you just count from this carbon to describe the number on the double bond. So this is 1, 2, 3, and omega-3 would have the double bond here. 4, 5, 6, so the double bond's right here. So this is an omega-6 fat, okay? And it's a PUFA, so there's also an omega-9 fat right here. There's always a skip carbon which doesn't have a double bond on it. This carbon, which has only 2 hydrogens coming off it, that's also called a methylene bridge. So the C8 carbon in this PUFA right here is where the methylene bridge is, and that carbon is vulnerable to lipid peroxidation. Okay, you can write out the nomenclature of a fatty acid with the C for number of carbons, 18 carbons, and then 2 for the number of double bonds. And this, just like omega, is like from the omega end. Their position is number 6 and number 9. Okay. The carboxylic end, we don't count from there. It works to count from this side. Okay, I'm mostly going to go through the pictures. I think that's most relevant. And you only need a real tiny amount of omega-3s, okay, and omega-6s. They are the essential fatty acids. They're shorter length forms. And you just get them enough from eating plant foods. You don't need to worry about it. There's this big push trying to tell everybody, oh, you need to get all these good fats. Dr. McDougall, myself, Nathan Pritikin, we studied that. That's, we believe, completely exaggerated. You really don't need that much. Jeff Nelson has a good video about that too. Here is Ulysses and the Sirens. This is a painting by Herbert Draper, okay? And that people are always hearing on the internet, in order to sell you something, they got to tell you you're deficient. So you're always going to hear people saying, oh, you're deficient in this, you're deficient in that. I can tell you, I'm a clinical doctor. I see patients every day, and I can tell you almost all patients have the same disease. Almost all of them. Hypertension, prediabetes or diabetes, leading to atherosclerosis in their heart, in their brain, and everywhere else in their body, in their spines, in their eyes, their ears, their Johnson, everywhere. Okay, so you don't want that. What should you be afraid of? You should be afraid of obesity, hypertension, diabetes, and atherosclerosis, because those are ubiquitous. I don't even look in the chart. A resident calls me up, can you come over here real fast, help me out, I'm having trouble with the procedure, okay? I just go to the procedure and assume the patient has all those diseases. That's a safe assumption, based on, I've been a doctor over 30 years, all right? Okay, so anyways, that's what you should be afraid of. I've never seen a patient with protein deficiency. I've never seen a patient with omega-3 deficiency. I've never seen any of this stuff, okay? Calcium deficiency, it's all, you know, I don't think that those are the things to be thinking about. All right, so pay no attention to all those siren songs. It's a lot of money in selling you fat and protein. Omega-6 cooking oil theory. Okay, this is this theory of Tetsumori Yamashima, the Japanese neuroscientist. He's the guy who was asked, why are so many of these Japanese people becoming demented? And he found it's from eating too much cooking oils. Okay, that leads to a whole cascade of reactions, including lipid peroxidation, production of toxic aldehydes, hydroxynonenal, and then a whole series of other reactions ending up in what's called the Kalpain-Cathepsin theory of neurodegeneration. Okay, he's an MD, PhD guy, works on a dementia journal, real bright guy. Here's one study done by Peter Cole back in the 1950s. If you feed a patient saturated fat, they'll have peak lipemia, highest amount of fat in their blood, at about 5 or 6 hours. They would check the patient's blood lipids every 30 minutes. And there was some hope in the 1960s, after Ansel Keys published all this data showing how bad saturated fat was with all the animal foods, the like 7-country study and all that stuff. Then people had hope that PUFAs would be better. But it turns out when they tested the PUFAs, and Peter Crow tested this stuff, also, Ray Rosenman, Meyer Friedman, the ophthalmologist, tested this stuff. It was even worse with the PUFAs, polyunsaturated fats. And just so you can see, when the people ate just a pure carbohydrate diet, they didn't bump their lipids. And that's what you want. Because the patients, Peter Crow did this with angina patients, and right when they were at peak lipemia, that's when they had the most angina attacks, cardiac atherosclerosis, coronary artery disease-related chest pain, which is a pretty dangerous thing to do. They had no way to effectively treat the patients in those days. There was no cardiac cath, angioplasty, or stenting back in those days. Okay, let's see here. Oh, Dr. Quo also noted that the thick blood caused a drop in the oxygen delivered to the tissues of about 15 to 20%. Ray Swank later noted that in hamster brains, he would get, with a high-sat fat meal, he would get a 30% drop in oxygen delivery to the brain tissue. You don't want that, okay? That could put your brain cells at increased risk for apoptosis. And it's actually worse in the modern world because not only are people dropping the oxygen delivered to the brain cells, they're simultaneously ramping up the brain cell metabolic rate by things like caffeine, that's a stimulant, glutamate in monosodium glutamate, manufacturer-free glutamate, that's a stimulant. Glyphosate is also a stimulant for the same reasons. It's activating the NMDA receptor, that's the glutamate receptor, because it's also a coincident detector. It binds glycine. Glyphosate is thought to also activate that receptor and thus increase the activity of the NMDA receptor, which is a calcium channel on the postsynaptic neuron to allow more calcium into the postsynaptic neuron, causing more activation of it. We talked about all this stuff in a bunch of my other lectures, but calcium is like the aristocratic ion that activates things. It's like the mama in the house, okay? And it says, do this now. And it activates the neuron. So you don't want an abnormally increased amount of calcium flowing into that neuron, because it'll become overactivated, which can cause insomnia, anxiety, hyperactivation. And if it really gets out of proportion to the amount of oxygen and glucose being delivered, that neuron can die from apoptosis. Too big of a gap between the neuron's metabolic rate and its oxygen and glucose delivery, its ability to produce energy, which also is coupled to, now we're I'm not going to get into this in much more detail, but this is the Peter Rogers, MD, theory of neurodegeneration, supply and demand theory. I got a bunch of other lectures about it, whereby these people also often have mitochondrial inhibitors on board. Glyphosate's a mitochondrial inhibitor. Atrazine is a mitochondrial inhibitor. Those are like the two most common herbicides on your processed food. Okay, and I think we'll stop right there for today, but that's a big thing to learn. That's one of the most important things you can learn in all of medicine. High-fat diets, especially sat-fat, cause insulin resistance, and that's the main risk factor for type 2 diabetes. There's other risk factors, high-sodium diets, high levels of blood uric acid, okay? But we'll leave it for there. That's a big thing to know, and it's because the fat gets into the skeletal muscle faster, and the skeletal muscle can't handle it.